Hello, my name is Brandy. I chose to cover Scheuermanns disease, which is also known as Scheuermann's kyphosis. It is a disease that develops in adolescent children and is more prevalent in males than females, as it is found to be twice as likely for a male to have it than a female. The phenotype, it presents itself as poor posture, stiffness, back pain, and maybe extreme thoracic kyphosis. And on an x-ray, it looks like wedged shaped vertebrae. The genotype is not exactly known by researchers, but they believe that it can be caused by an autosomal dominant inheritance, which means that it could be a mutant gene or chromosome that can cause you to have a 50% chance of developing this disease. Environmental factors such as physical activity, growth patterns, even weight, or poor posture can put you at risk, well, not put you at risk, but can influence these genetic risk factors. As a DMP, I would develop a program that would focus on early detection of the disease. So we could start at maybe doing screenings during school, the early developmental or early childhood examinations that they have at the primary care providers, and maybe school physicals, if we detect it then, or if they present with having complaints of back pain and curvature of the thoracic vertebrae. From there, we could refer them to have x-rays to confirm if whether or not this is that this is it's indeed Scheuermann's disease, and then also involve orthopedics, and then from there, if they are confirmed to have Scheuermann's disease, we would want to refer them to resources such as physical therapy, orthopedics again, because there's no testing to detect Scheuermann's disease. Genetic counseling wouldn't help, like genetic testing wouldn't help, but maybe genetic counseling would help, so that families can determine what are their risks of this being an issue for their family, or the possibility of future children having this disease. A multiple disciplinary resources would include, again, having orthopedics involved, school nursing, and possible mental health support in the event that an adolescent may have Scheuermann's disease and they're battling issues with like their body image or body dysmorphia. And then also perhaps a support group with other adolescents that may have similar conditions. The legal aspects or ethical issues that may present itself would be that we would need to have consent to treat, and obviously providing privacy for the adolescent and their families. Ultimately, the goal for the DMP is to improve clinical outcomes for the patients through education and early detection, and implementing interventions to help support that patient and their families.